a lot of us go into medicine, thinking, I just want to help people. And I think, we try to say that we don't look for the thanks. And you want to feel like you really are at night, you're able to lay down and go to sleep because you've done the right thing for the day. I do, and getting this award, again, showed me that I was valued and that I am valued in what I do, and I continue to do with Geisinger and Geisinger Commonwealth School of Medicine. I believe that they chose me for the Innovation Honoree based on the impact that we had on patients as a team. We developed, for example, a patient-facing program that was called the We Care and We Remember. It's a remembrance ceremony for patients who were cared for within our Cancer Institute and Neurological Sciences Institute. And if those patients did die, we made sure that we continued to honor those patients and remember them in one of those remembrance ceremonies. I do believe that the work with the students was probably most impactful in helping to guide this honor in particular, and that we worked very closely with some very, very dedicated donors to design research that was set to understand our rural population there in Pennsylvania. Before that time, there really was not a lot of focus on rural, disparate populations, and they were often overlooked as a particular community with different potential medical and clinical outcomes. We ultimately, after about 4 years, did our statistics and looked at our metrics and determined that our glioblastoma patients, which is the most common, most deadly primary brain tumor, were living about 2 times that of the national average. And that was based on the way that our team got together and took care of those patients, from the early diagnosis to the innovative and interesting surgical techniques and radiation oncology techniques that we would use that would preserve their quality of life. It's one thing to extend life, but it was quite another for us to focus on extending quality life. I would like to thank the Commonwealth School of Medicine for opening their arms to me and helping to welcome me in and allow me to meet such amazing students that I hope that I have relationships with, forever. Really amazing people that gave me opportunity beyond just being a clinician. Being able to be a teacher was, by far one of my greatest, honors there. And Dr. Jeffries, really pushed for me to find more of that. There was one thing that I felt very compelled to make sure that I mentioned. One is about the donors that have made it possible to innovate there within the clinical enterprise as well as the medical school. We've had very, very amazing donors who not only suffered personal losses within brain tumor, but were very passionate about the fact that what we were doing was cutting edge, and what we were doing was beneficial not just to the patients and the families being treated, but for the entire community and the entire world ultimately through our innovations. Hats off to Nancy Lawton-Cluck and her team, being able, through the foundation, being able to support that and make sure that at all costs it was supported, the work that we were doing. That's number one. And the second thing is, I wanted to say thank you to all of my colleagues, all of the people at the hospital, but then also at the medical school. The opportunities that Bill Jeffries and Dr. Scheinman made possible for me, were remarkable. And being able to be a clinician is not half as rewarding if you don't also get to teach the students. So I have to say that those two things, were on the top of what I feel like were the most valuable things to me during my career.